Your health is an investment, not an expense. Hello everyone, welcome to BMC Global Live Hilal Health World. I'm Swathi and today we'll be discussing about osteoporosis. We have Dr. Abraham George here with us and he is an orthopedic surgeon at Al Hilal Hospital, Adlia branch. He has a total work experience of 29 years in the field of orthopedics. Hello doctor, so happy to have you here. We'll start by asking you what is osteoporosis?
Osteoporosis is one of the very commonest problems which is often missed because usually people don't come with a particular symptom or a problem mentioning. So it's considered as one of the silent diseases, and usually the people present it only when they have a fracture, and sometimes it's a little too late to diagnose and prevent the fracture. The whole idea of the treatment is to prevent the fracture.
Yes.
And like everybody knows that because osteoporosis is much more common in the ladies.
Yeah.
And usually this happens because, especially in the elderly ladies after the menopause, the hormonal changes happens and the protection for the bones suddenly decreases, and so they are much more prone to fractures. If you see in this picture, what is on the left side is a normal bone and what is seen on the right side is an osteoporotic bone. So we can see that the osteoporotic bone is much weaker compared to the normal bone, and hence it is not able to take the same load as a normal bone can take. And why osteoporosis happens? This is because there are two types of cells mainly in the bone. Generally, we don't think of bone as a living tissue.
Okay.
We think it's like something which doesn't. But the true fact is that it's a continuous activity going on. There are two types of cells I mentioned. One is called osteoblasts, which are actually laying on the new bone. And this process continues throughout our body, throughout our life. And there is another set of cells which are called osteoclasts, which are the ones which removes actually the older bone. So this is a continuous process which happens, and this is what causes the bone to grow. If you see in the next picture, you can see that the bone is slowly growing over from the young age up to the age of 30 years. That is because the osteoclasts are less active and the osteoblasts are laying in more bone. And this process continues till the age of 30 years. That is why we call it as a peak bone mass which reaches at the age of 30. And then both these activities are sort of balanced. So till about 40 years, the same peak bone mass is maintained. But after 40 years, the osteoclasts become more active and there is not so much of laying in of new bone. So the bone starts becoming weaker. And especially in ladies, usually around 50 years is when they have the menopause, and there's a sudden rapid decrease in the bone strength, almost up to the stage of about 25% of the bone starts disappearing. So why I mention this is because it's important to know that the more you build up your bone during your younger age and the peak bone mass is higher, the chances of going into osteoporosis is much less.
So doctor, what are the risk factors?
The risk factors, we can actually divide it into two sets of risk factors. One is which is under our control and one which is not under our control. The one which under our control is what I say is like the calcium intake which needed for the strengthening of the bones, adequate vitamin D intake or maintain the levels, exercises, regular exercise which are actually loading the bone, because the bone strengthens as we put weight through the bone. So weight bearing exercises like walking, jogging, all these are much more useful than things like cycling or swimming because it doesn't put weight through the bone. So exercise is an important thing. Then the other thing which we can avoid is smoking, alcohol intake. Both these things are making you prone to osteoporosis.
Yeah, for sure.
Also, you need to maintain your body weight, because one of the risk factors which is associated with osteoporosis is a very low body mass index, which is usually what we call as less than 20, which is also a risk factor. And of course, there are some medications which you are regularly taking may also put you at a risk. At the same time, you have the factors which is not in our control. These are actually like your family history. Like if you have a parents, one of the parents having an osteoporotic fracture, you have a higher risk. At the same time, you also have more chances, like I mentioned earlier, is in the female gender. So that is something which is not in our control. Also, there are some diseases which are associated with increased risk. Again, we cannot control those. Age is another factor which is usually associated with osteoporosis. So increased age is also a risk which we cannot control. At the same time, there are some diseases which we can also alter the control of it and also prepare ourselves. Some of the things are like you would have heard of eating disorders, where people go into a very severe diet and they start losing weight. That is a risk because two factors. One is the body mass index is going down. Second is they miss the nutrients including calcium and the vitamin D. Then there are things like hyperthyroidism, uncontrolled, diseases which are causing malabsorption other than not the eating disorders where the food is not absorbed. Then some of the joint diseases like rheumatoid arthritis, some of the diabetes, all these are increasing your risk for osteoporosis. So what are the medications which you might want to know? Because the commonest things which causes osteoporosis are which are used in seizures like fits. People have those medications. There are also medications which are taken for, very commonly taken for gastric reflux, so people call it as heartburn. Those are also increasing your risk for osteoporosis. Some of the cancer medications and some of the medications which is taken in people who had post-transplant, those medications are also put you at a risk for osteoporosis.
So how is osteoporosis diagnosed?
Osteoporosis is diagnosed if you have already a fracture which is after a very trivial or a slight injury, which is one of the easiest way to diagnose an osteoporotic fracture, where we don't expect a fracture and we find that there is a fracture, which actually make you suspicious that the patient is having osteoporosis. Then one of the other things which is very easily diagnosed is loss of height. You would have heard like as you become older, the height of the person comes down. This is usually suggestive of a fracture in the spine, what we call as a collapse of the spine. And usually if you lost height over a short period, like more than 1.5 inches, then that is more suggestive of osteoporosis. Then of course there are some calculators like which is available online which are called fracture risk calculators. So you feed in certain data and you look for it, that will give you directly your risk for an osteoporotic fracture. So these are all things which suggest, but at the same time we need to confirm the things, because there is something called bone mineral density, which is usually done by two methods. One is the mass screening, like if you would have seen in supermarkets and things where you put your heel into a machine and it will give you a rough estimate. But this is not diagnostic to treat a patient. This only is for mass screening. But the ultimate test or the gold standard is called Dexa BMD or Dexa bone density, which is like an X-ray machine. It takes about 10 to 15 minutes. You just need to lie down, and usually they measure the hip, both the hips and the spine. And that will give us a number, which is the way of diagnosing the thing, whether you have an osteoporosis or not. Again, this gives a value which is called T-score. That is the main thing which we go by. The T-score is calculated as in relation to the peak bone mass which I mentioned earlier. Like if you are at 30 years, again changes depending on which group of people you belong to. So there is a calculation depending on your peak bone mass, and you get a standard deviation which is mentioned as the T-score. And if the T-score is within up to -1 is considered as normal. -1 to -2.5 is considered as weak bone, or we call it osteopenia. And -2.5 is called osteoporosis. So this is the gold standard or the test which we need to diagnose an osteoporosis. At the same time, if you have a fracture, like I mentioned earlier, a fragility fracture, whatever your score is, you automatically go into osteoporosis.
We'll go for a short break and we'll be right back.
വിഷമിക്കണ്ട, എല്ലാം ശരിയാവും. ലുലു മണി, സ്നേഹപൂർവ്വം.
വർണ്ണവസ്ത്രങ്ങളുടെ കമനീയ ശേഖരവുമായി വനിതാ ടെക്സ്റ്റൈൽസ് ബഹ്റിൻ ഇന്ത്യൻ ക്ലബിന് മുൻവശം പ്രവർത്തനം ആരംഭിച്ചിരിക്കുന്നു. വനിതകൾക്ക് മാത്രമല്ല, കുഞ്ഞുങ്ങൾ മുതൽ മുതിർന്നവർ വരെയുള്ള സ്ത്രീ പുരുഷ വസ്ത്രസങ്കല്പങ്ങൾക്ക് അനുയോജ്യമായ വൈവിധ്യ ശേഖരവും വനിതയുടെ പ്രത്യേകതയാണ്. ഇന്ന് തന്നെ സന്ദർശിക്കൂ വനിതാ ടെക്സ്റ്റൈൽസ് ആൻഡ് റെഡിമെയ്ഡ്സ് ബഹ്റിൻ ഇന്ത്യൻ ക്ലബിന് മുൻവശം. വി ഹാവ് ഗോട്ട് ഫാഷൻ ഫോർ എവരി വൺ. വനിതാ ടെക്സ്റ്റൈൽസ് ആൻഡ് റെഡിമെയ്ഡ്സ്.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 39096845 3909 4806 38852397 or visit www.bahrainmediacity.com. IMAC Cochin Kala Bhavan.
Welcome back to BMC Global Live Hilal Health World. We have Dr. Abraham George here with us. Another common question is how to prevent a bone loss and fracture.
Okay, there are few things I mentioned in the discussion earlier.
Yeah.
So one of the things is adequate calcium intake. What we mean by calcium intake is our requirement day is 1200 milligrams, and in case our diet doesn't supply you that much, then you need to take a supplement so that you reach your daily requirement. Second thing is vitamin D, which is very common, people are suddenly become very
Yes.
aware of it,
Yes.
which is again what is needed for the calcium to be absorbed into the bone.
Yeah.
So if your vitamin D normally comes from the sun, like everybody says it is from the sun's rays, but unfortunately in this part of the world, we are not able to do that because you have to be exposed to the sun between 10 and 3 during the day, which is usually very hot over here.
Yes.
So vitamin D, the low vitamin D levels are very, very common in this part of the world, even though there is a lot of sun here. So we need to take a supplement, and your daily requirement is 1000 to 1200 international units. So most of the time you need to take that as a supplement. And also it's good to know your vitamin D levels. You can do it by a simple blood test, and if it is low, that needs to be treated. And also, like I mentioned earlier, is you have to be active, you have to be exercising,
Yes.
and also maintain your posture to prevent osteoporotic fractures. And how to build the bone, you should do weight bearing exercise, like I mentioned earlier. Unless the exercise also strengthens the muscles, because you need the muscles to support your bones.
Yeah.
So exercise has got a double role in preventing fractures. Okay, one another thing, because I mentioned earlier that it's very common in elderly people, and one of the causes of osteoporotic fractures is a fall, which can happen especially in an elderly person. Sometimes they may be staying alone. So how to prevent it? One is actually to avoid anything which they can trip over. So make sure that there is nothing which in their way.
Yeah.
Second thing is check their eyesights, because eyesights are very important in seeing, obviously. So eyesight is poor, so they can actually have more falls. The third thing is adequate lighting in the rooms, especially when they get up in the night. You can use things like a floor light or something which make them able to see things, because if something is there again, the tripping thing is there. So last thing is like check their medications, because sometimes they may be taking a medication which may be making them sleepy. So which sedates, which you should avoid, especially in the night. So that is another way of preventing the falls.
And lastly, what are the treatments to prevent fractures?
Yeah, like I mentioned earlier, there are two processes which occurs in the bone. One is the bone building, and the other cells which are removing the dead old bones. So most of the medications which are anti-resorptive agents or which prevents the breaking down of the bone. So like I mentioned earlier, the osteoclasts are the cells. So most of these medications are slowing down the activity of the osteoclasts. So whatever bone is formed, they are actually retained. The commonest one which we use is what is called bisphosphonates. There are again a few available. Some are tablets, some are injectable forms. The advantage of the injectable forms are they last much longer. There are some injections which you need to take once in a year. Some of them are once in 3 months. And there are tablets, it varies again. There are some which you take weekly, some of them monthly. And these are the things which bisphosphonates group is the one which anti-resorptive. Also, there are something called selective estrogen modulators. They are actually similar to the hormones with more specific function on the bone. They are also at preventing the resorption. Then the second one is what is called anabolic medications, or some which helps in the building of the bones. Those are very few actually. There is one parathyroid hormone which is available called Forteo, which is actually again a subcutaneous under the skin injection, which actually helps in building the bones. So these are the two major types, and you will always need to discuss it with the person who is treating you, because sometimes it depends on your condition, because elderly people many times, if they have to take a medication every week or every month, they tend to forget. So it's probably better to give them a longer acting once a year injections or once in 3 months. And at the same time, if somebody who can remember, who can take the medications regularly, you can go on to oral tablets and avoid the injections. All these medicines also have their own side effects, so that has to be first discussed with the doctor. So depending on which is convenient for you and which one you can tolerate, we can decide on the medications.
And what are the takeaway messages?
Yeah, I'll summarize what I've gone through.
Yeah.
The main takeaway messages are like I said, your adequate calcium and vitamin D intake, which of course the natural source like the food and the sunlight is the best, but
Yes.
you always have to supplement depending on the needs, because if there are people who cannot tolerate certain foods, people cannot go and expose in the sun. So all those places where you need to supplement and make sure that you have adequate intake. Second thing is to load the bone, which is what is called weight bearing exercises. This is very important, and also you should make sure you're able to balance. And like I said, in an older person, it's very important that they have the eyesight is checked and maintained regularly. And the last thing is you should always discuss your risk. Like I said, there are some risk calculators, there are diagnostic tests. You should always check these and also find out the strength of your bone, and also you should follow it up. It's not like one time and you're normal and you leave it. You need to adequately follow up. Even if you're on a treatment, you need to at least once in 2 years, you need to repeat the bone density and make sure your bone strength is maintained. The whole idea of the treatment for osteoporosis is not just to improve the numbers. It is actually to prevent fractures. So if you have managed to do that, that is the whole purpose of this exercise.
So doctor, you've answered almost all the important questions. Now let us know more about you. Where are you from? Where did you do your studies?
Yeah, actually I'm from India, like you know, and fortunately I was trained in one of the best institutions, I would say, which is the Christian Medical College, Vellore. and I did my undergraduate and postgraduate studies over there. And I also had an opportunity to do some trauma training in Germany, which I did a fellowship over there. And after that, I've been working in Bahrain for almost more than 20 years.
That's great to know. Thank you, doctor.
You're welcome, and thanks for your time.
Hope you all found this episode informative and useful. Until next time, I'm Swathi signing off. Take care and stay safe.